Thank you, everybody. Thank you for coming back for the afternoon sessions. I would like to give a couple of more minutes. I'm waiting to see Helena, who is going to be the, oh, she is here. Okay, hi. So thank you very much, everybody. We'd like to start the afternoon session. The afternoon session will continue the theme on the COVID, which was given so wonderfully in the morning around the governance issues. We'll continue this afternoon looking at public health and social measures as countries are moving from a pandemic to an endemic situation. And in this regard, we have three people who will be involved in the discussions today, and also who've done a lot of work on this already. The main presentation will be given by Dr. Helena Leguido quickly, and then we'll follow with Dr. Kathy Andres and Dr. Owen Tranmai, who will bring in country-specific situations and analysis. For those of you who don't know Helena, Helena is the, let me get it right now, the associate professor or assistant? Associate professor in Salisbury Hock School of Public Health in the US. Previous to that, she was working in London School of Hygiene. She's also a fellow of Chatham House. She has done a lot of work around health policy, health system issues in Europe, in Sub-Saharan Africa, and in Asia Pacific region. And her particular areas of interest are migrant health, gender equality, science, global health governance, and health system resilience. And this piece of work that we are going to be talking about is based on the health system resilience that APO has been working with Helena and her team in Asia Pacific. Most of us know Kathy already. She was in the previous panel. Kathy is used to be the Dean for Research at the College of Public Health, but she's now moved to run her own NGO, Alliance for Improving Health Outcomes in the Philippines. And again, her areas of interest are health financing, governance, and regulations, and health policy system research. Dr. Owen Tranmai is the director of the Health Strategy and Policy Institute in Vietnam, in Hanoi, in Vietnam. She became director in 2013. She got her medical degree from Hanoi Medical School, did a master's degree in public health in Karolinska Institute in Sweden, and did her PhD combining with the School of Population Health, University of Queensland, with the National Institute for Hygiene and Epidemiology in Vietnam. And her interest is primarily, as somebody who works in a government think tank, it's feeding the policy recommendations and evidence into the policy in the Vietnam situation. So evidence and technical consultation for health policy making within the Vietnam, as well on specifically on the regulation and formulation, assessing impact of health policy implementation. So with that, I would like to ask Helena if she wants to start her presentations, and then we'll bring in the others. Helena, is up over to you.
Many thanks, Nima, for the introduction. Can you see my screen, and can you hear me properly?
Yes, to both of them.
Okay, great. So as Nima said, we've been doing a lot of work in the Salisbury Hock School of Public Health on two key topics, health systems resilience and public health. So I'm going to try, I think Nima said I have around 30 minutes. I'll try to be a bit shorter. If that's okay, Nima, around 25 to 30 minutes. I'm going to try to go through our learning experiences and the work that we have done at the school. And also I thought it would be useful to present a bit on some other work that we've done globally. So we will be zooming into the global, the region, and the national, and then maybe we'll hear much more from Kathy and colleagues at the national response, also more specific, so we can open to discussions. And as you see from the title, I've tried to combine both the public health approach and the health systems, and I will make reference to both during my presentation. So, of course, we at the Salisbury Hock School of Public Health, our team, we work much more on health systems we have a health systems approach, and we look at health systems resilience. And what happened was that we were doing a lot of work already conceptually, and also working with the London School of Hygiene. And when we were looking at health systems resilience, we were particularly interested on how a health system can respond to a shock. Of course, we used to focus on other areas, and we looked at the financial crisis. We were very interested on that. That's how I started getting interested in health systems resilience as a concept. Then, of course, there were other shocks to the health system. One was the migration, and I also did some work on that. And then we had also the Ebola. So this was a big team working together to understand how can we adapt a health system when the health system receives a shock. And of course, here you have a very basic graph, but the overall idea is that you need to plan in advance. And we know already that the countries that have planned in advance in terms of COVID, they generally did better. Then the health system needs to be prepared to absorb the shock and then to recover. And then now we would be in a phase not yet there, and some are more positive than others, where we need to now thinking of how do we adapt our systems for the future. And of course, with the health system, although they've been under a lot of shock, there's some positive aspects that we need to consider, like telemedicine, that maybe we can adapt, and we can changes that we wanted to see for many years that did not happen, had to happen because of COVID-19. So also some effects that we could see as a positive, but of course, most of them are negative, and now we need to plan for the future. In terms of health systems resilience, we at the Social Work School of Public Health, when the crisis started, I was talking to my dean, and the first thing that he asked me, why I think most of you know him, it was if I could think of the angle that I'm working with, and think of not only Asia, but also looking at other countries. And this is the work that we've been doing with the independent panel that I will explain a bit more later, but the idea is that while I was working in Singapore, I was asked to join the overall evaluation of the response that member states asked WHO to conduct. And as part of that work, they asked me to do a review of 28 countries. And you see here one of the papers that I published, and it was looking at the health systems resilience. Here, the important bit for me to highlight is that when we look at health systems and public health, suddenly we were encountered a bit with most of us are public health experts, but then we have the expertise of health systems. So it's how do we combine both? And then when we were looking at COVID-19, it's like normally public health measures are looked independently. They're not so much integrated into the health system, but now we've all realized that we need to look at everything as a system. So we cannot continue doing our little works. And sometimes with a bit health systems experts, we don't work so much with the experts on pandemics. So it was this idea, we need to start all working together. And not only that, we need to start analyzing all the components together. So we developed this very simple framework, but trying to amalgamate all these issues. And of course, you all know the WHO one. And there were the only two changes that we made in principle were to include much more clearly the public health functions that you see in that framework, and then to put community at the center, because we already saw with the COVID pandemic that the community was key. And then this idea of collaborating across sectors. And then, of course, we have here what were the key functions that we identified that had to be activated, adapted, preserved, and reduced. And maybe you can have a better look a bit later because it's a bit too detailed. But the one that I wanted to highlight also on the right is this idea that we have to continue learning. And this idea, learning and adjusting. And I think this has been one of the biggest failures in the pandemic, particularly more in European countries, this idea of having to monitor, having to evaluate. All of us that work in public health, we are so used to monitoring and evaluating. And somehow countries were not prepared for that, for learning from the experience, learning from the first wave and adapting to the second wave. This has been, I think, a lesson for us to take into account and how we can avoid that if there were to be a next pandemic. So in terms of work, we were very keen in conducting work on health systems resilience because it was our area of expertise. And then the first paper that we wrote here, a comment for the Lancet also with Nima, it was this idea of, okay, so everything started sooner in Asia, and what our starting point is that what could other countries learn from countries such as Hong Kong, Singapore, and Japan? And of course, we could not predict the future, and we did not predict it, but I think we were quite surprised by the fact that the title of our paper was "A High-Performing Health Systems Resilience Against the COVID-19." And I was thinking particularly because at that time I was based in Spain. Like, what countries that are very performing very well, are they going to be resilient? And of course, this was published the 14th of March, and already I think it was the 21st when countries started closing down the borders in Europe, and when it became evident that they were actually not prepared. So we continued doing this work, and our idea was very much to contribute to the debates and to document experiences where we thought other countries could learn, and to try to do it as quick as possible. So it was for the first time that we were, as researchers, as a team, we were really working very hard and trying to talk even to the journals, can you publish this quick? Because we thought other people could learn from experiences in other countries. And I'm very much aware that some of these papers were discussed at government level in different countries. So we were very happy about that. Then once we had the first wave, it was this idea of now what's going to happen when we open up, how do we transition? So for us, it was also very important to document that process. And then we decided also, we were already starting to realize, and I was between Europe and Asia, and I was very interested in doing this comparative analysis. We already started to see that countries were following different approaches, and that somehow, and this is another failure, I mean, I'm going to also talk about some of the strengths, but that was also another failure, I think, of the response, the very little cross-border collaboration that we've seen. And I think we need to find a way of either an institution or who can take that role in helping countries to work better together. And I know APO plays this role very well in Asia, but we need to have it in a global way, in the sense that I think Europe would have benefited a lot from the experiences of African and Asian countries, and that did not happen at the time that it was required. So this paper was trying exactly to do that. We start this debate in terms of looking at the two regions, looking at different perspectives. And here you can see that we needed to come with a new framework, because when you're opening up, again, it's like, do we look only at the health system? Do we look at public health measures? And for that, we decided to look at the governance issues, because we realized that coordination at the national and subnational was key in terms of opening up and deciding what strategies. It was already becoming very evident that community engagement was key in two aspects. One, in participating in the response, but also for risk communication. So many countries also did not do very well in terms of involving the community in designing campaigns, and that has been a failure in most countries, particularly involving the younger population in European countries, and perhaps the older population in Asian countries. And then for us, it was key to implement appropriate public health measures, because we were already starting to see something very interesting, which was that in Asian countries, very quickly, countries implemented contact tracing, involved the community on that, developed the systems, established or hired the people that were needed, or involved the community health workers. It was very clear that these systems had to be in place from day one. And very strangely, in Europe, the discussions only started 6 months later. So it was somehow, there was this not awareness that the contact tracing was key, and following up the contacts and conducting the testing and isolating. This, I mean, it feels like it was two worlds apart. So we wanted to document that and suggest that countries have to really, in Europe and the US, make an effort to introduce these measures. And then, of course, the health system had to be prepared, and there were different ways of engaging human resources. And the big question mark, and that perhaps we can discuss later, it's border closures. So we know that WHO did not recommend that. We do know that Asian countries took a different approach than European countries in terms of border closure. And I think the jury is still out there, but I think overall, it did challenge some of our public health principles. And I think overall, most people, particularly in Asia, will agree that the closing of borders was, at the time that it was done, when it was not suggested, it helped a lot to contain the pandemic. And of course, once we started doing all this work, all these comparisons, and this was already a year later that the BMJ contacted us, and they were like, oh, but we've seen that some countries, they already had some lessons learned, and they had some systems in place, and they seem to have responded better. I mean, that seemed to be like a bit of a surprise. Like it got by surprise, particularly in Europe, is that, oh, some countries had already preparedness plans in terms of drill exercises. And then we were asked to write this paper, and we were providing experiences. Interestingly, all the countries that were included were either in Asia or in Africa. So I think this is also like a key lesson learned and a bit of a message for European countries to perhaps that they could have been a bit more humble and they could have listened to the experts. That this time, I don't think most of the experts were either based on Europe or the US. They were more based in Asia and in African countries. And we've seen that in African countries also because of the Ebola response. I mean, when I did this work in 28 countries, some of the key experts were in Nigeria, in Liberia. They did not have sufficient resources, but they did know how to put systems in place. And a lot of the time it's about being organized. That's what we've learned also. And here I just wanted to put some highlights in terms of what because I was even surprised myself about all these drill exercises in Singapore that they were conducted at the hospital level and the drill exercises at the national level. And I still think that this idea of preparedness has not been emphasized sufficiently because this type of drill exercises, most countries did not conduct them. So this is something for us to, moving forward, to reconsider this. And here you have, I like this graph that it says start when you start with the crisis, and the contact tracing, it's six hours after it has been informed the hospital, it has already been set up. So I wish that if all countries had set up a contact tracing system in 6 hours from learning about the emergency that WHO launched, I think we would have been much better. So this is following on that. And then in this idea also of the idea of involving the community. So that's also a lesson learned from previous pandemics. And we saw that the countries that had already previous pandemics like SARS, that they were able to have systems in place, that they were able to have stock, like was the case of Singapore and other countries, they performed much better, particularly on the first wave. And also the countries that already had these systems in place in terms of co-producing strategies like Thailand, like South Korea, they all also performed better. But of course, this is a combination of issues that suggested which countries were more successful than others, and I will go into a bit more detail later. Now I'm just giving you some highlights. So as I said, we looked at 28 countries. We looked at what were the key aspects for successful countries, high-performing national responses. Important to highlight that not all countries had all these components. So it's a mixture of these components that made some countries more successful than others. And we also know that some countries that things changed a lot, that some countries that did very well, maybe they relaxed some of the measures in terms of public health measures, and then the indicators were not so encouraging. So it's also taking into account that these things have fluctuated. But we did identify some specific aspects that we thought worked quite well. So as I've already mentioned, most of the countries that did well, they partnered, they coordinated appropriately the response, they developed strategies, and they strengthened their own systems. And prior experiences, it was very important, but it was not only having prior experience, but implementing what they have learned. Because we saw cases for every positive aspect that we identified, there were also exceptions. So for example, Mexico had very good preparedness plans. They had experienced pandemics previously, but at the end, they did not implement the plans. So both have to go together. The countries that did better, scientific advice has been key in this pandemic. We know they work with experts, either in expert committees or they have their own institutions. Countries that had their own institutions, like the RKI in Germany, I've just come up from the World Health Summit in Berlin, and it's quite impressive, the work that the RKI conducted. Public health institutions, independent from government, or as much as independent as possible, conducting this type of work have been very helpful. But of course, you needed a governance level that trusted the science, that they listened to the scientists and implemented the policies. Of course, tough decisions had to be made, but this idea of having leaders that listen to the science, that were empathetic, it was considered a key component for successful responses. And here to highlight particularly that these components, if you think about them, they're all like softer components, that they were not present in all the rankings and measuring if countries were prepared or not. And this was a key message emerging also from the World Health Summit that I just came back from in Berlin. This idea that for the future to prepare, we need to think of other indicators, and that softer components such as governance and trust, they've proven to be crucial. Now, moving more to the aspects of the health system and public health, what we saw is that those countries that engage the community, that they had referral processes between primary hospital services and home services, which has proven to be very important and which has proven to be devastating in countries such as mine in Spain, where so many people died in residential homes and so many people were left dead even for weeks in those residential homes. And even the military had to intervene and help because it was a dramatic situation. So this was also very important, being able to those that they were better coordinating between the three systems. And finally, in terms of public health functions, of course, involving the community, we know having proactive testing and contact tracing strategies, and then also the question mark on quarantine and isolation facilities. I think now there's a lot of interest in whether it worked or not, and what were some of the challenges in terms of human rights, and these areas also have to be considered. And those countries that had active surveillance, they also performed much better. And overall, a key aspect that has not been emphasized sufficiently, I think, but it's very important, is also to have social and financial support so people and particularly vulnerable groups could fulfill and could comply with the measures. So you see here, the same way that we've talked about those that did very well, we've also emphasized those that did not do so well. And some of the areas are the opposite. And perhaps you can, at a later stage, you can have a better, it's quite busy this slide. But I think what we know is that a lot of countries that did not perform very well, they did not rely on the science, they gave confusing messages, and also historically they had fragmented health systems, and also historically they did not invest in public health measures. And particularly for European countries, austerity measures did hurt a lot of the health systems. We saw that. So some of the strong health systems like the UK, Spain, they were very damaged, particularly public health. It was damaged by austerity measures. So that also we need to take that into account. In time of crisis, if you decide to cut your funding for fundamental services like public health, then you're going to suffer if you have a new crisis. And now I wanted to spend a few minutes talking about more at the global level. So as I said, we've looked at the countries, what they did well, what areas could have been improved. And then while we were doing this work, we were asked by Helen Clark and Madame Charliff to join the independent panel, which was asked by member states from WHO to conduct an evaluation of the response. So that for us, we were very much involved, myself and the team in the Sosri Hoch School of Public Health with other colleagues. And it was very much an honor to be able to contribute to this process, because the outcome was to be a report with key recommendations that had to be presented to member states, and then hopefully they will take some action. Of course, we provided the evidence, and then the political process is another matter, but we're still hopeful that some of them will be implemented. And there's a special session in November where these recommendations are going to be discussed. So here it's the panel members. The idea is to have panelists with also like political clout, so they could help also in terms of navigating all the issues that need to be considered. And this in itself has been a very interesting experience of looking at a panel that very much rely on evidence to make policy recommendations. So the purpose of this independent panel was to look at the past lessons, to review what had happened. We thought it was very important to review exactly what happened, understand the impacts, and then propose the recommendations. And we actually have now, we've published several reports and several papers, and in a couple of weeks, we are going to have a paper on the chronology, what happened the first month. So we documented every day when decisions were made. So you might want to look at that paper. It will come in a couple of weeks in the Lancet. So the idea was lessons learned from previous pandemics, what had happened, as I said, how communities had coped, and then looking at the international system, but also at WHO. We consulted, we collected the evidence, it was non-stop work for 9 months, and then the idea was to have bold, actionable recommendations. So as you see here, it was a long process of interviews, roundtables, exchanges involving everybody. It was, and we ended up producing 16 background papers with all the different issues. And then the main report. The main report was, the idea was to have a short report that can have bold recommendations. So in terms of our summary of the report, in terms of what had happened, here are some of the highlights. And of course, this is 9 months trying to summarize it in a slide. But overall, what we suggested is that one of the biggest failures is that we had 12 commissions before ours in terms of, we had the Ebola commissions, we had commissions for SARS, we had recommendations, and what we were saying, what we are proposing is not completely new. Previous commissions had suggested some of the recommendations, and the key problem is that these recommendations had been, at the global level, had been ignored. And what we are saying is that it cannot happen again. So that was one of the key messages and the key worries, that the countries tend to want to move on once the crisis is over, and change does not happen. And then when we have the next crisis, we'll have the same problems of financing, of procurement, of a surveillance, because we have not solved the system. And what we were saying is that this is the time to do it. And we are hoping that the global community reacts and responds this time. So what we were saying is that overall countries were not prepared, with the exception of most Asian countries. So we also do present in the report the countries that, and we give timelines of countries that responded immediately. And it was the case also for many African countries. Once the alert was sound, while some countries reacted immediately, some other countries had a wait and see approach and actually wasted 1 month that they could have implemented some measures. We see that there's some delays, and you can see that in the chronology paper. And overall, the pandemic turned into a crisis because most countries, and I said they failed to respond. And also there were some challenges at the global level. So the report goes into detail into those challenges. The pandemic was not seen as a top global threat from the beginning. WHO was not empowered to lead, and we suggest some recommendations on how to strengthen WHO. And of course, we know that the financing was not sufficient and slow, and we're seeing it even more clearly now with the vaccines inequity that we've got right now. So I just wanted to go, it's not the purpose of this presentation to go into detail into the recommendations, but I did want to go through a bit more the ones that are related to public health measures and the national responses. So you can look at the report more. We propose like to create a new council above WHO to strengthen WHO also. But the ones that I'm interested for us is more investing in preparedness and also looking at surveillance systems, which will impact particularly at the national level. Of course, one of our recommendations, which has not been fulfilled already, was to urgently redistribute vaccines. I just wanted to highlight it because on this one, we've already failed as the global community. We were suggesting at least 1 billion vaccines doses to be shared no later than 1st of September. We have not fulfilled that target. And of course, we're all aware of how difficult it is and how frustrating it is that the global community has not been able to fulfill this objective. In terms of looking at the public health measures more directly, what we're suggesting is that, and here maybe we can debate it, there needs to be a way of evaluating and conducting periodic reviews. And this is currently discussed at WHO. I know they're drafting a new document, and we suggested some of the indicators they need to look at. And the discussion here is, do we do peer reviews? How do we do it? And how do we make sure that this data is reported adequately? Of course, we're asking for a global surveillance system that it's more agile. We know that there were some delays and how we can develop this system at the global level, but it's very much needed and all countries would benefit from that. And the other aspect that I wanted to mention that affects our national responses is the idea that we have to elevate the pandemic preparedness and response to the head of states, and that there should be appointed national pandemic coordinators that work directly with leadership. This is the tricky one because we were always saying that some countries ignore the science or did not take into account experts. So it's a way of going around that one, but it's a tricky one how to implement it if leaders don't want to listen to national coordinators or to the experts. Now, moving into the national level, we presented some of the recommendations that are here. And the idea here is very much looking at we proposed an iceberg model, which means that what we are proposing right now is what we are seeing in the top of the iceberg, but the measures that we really need to implement are hidden under the water, which are much more systemic aspects. So when we're saying that we need to implement measures at the top level, we're talking about public health interventions, risk communication and community engagement, and precautionary measures that we've seen that are key. But then the ones below are the most complicated ones, and the ones that we can discuss later in terms of ensuring resilient health systems, integrating long-term care, that we've said that it's key. We need to start monitoring the response and evaluating and learning from other countries. I've already mentioned these as challenges. Then, of course, we need to rethink expenditure for health. And there's a commission now at WHO that was launched also, very interesting, looking at the economics and health in a different way than we've done now. So this is one to watch. Then, of course, we need that in the context of universal health coverage and people-centeredness. And we definitely need to improve pandemic preparedness and response overall. And then the ones at the end, the most complicated ones, which are to do more with transforming societies, changing mindsets. We need to reconsider our vulnerable groups, our migrants, how do we want to include them in our health systems? And we need social protection measures. So we have a paper now coming up in Lancet Public Health on universal health coverage and social protection, combining both ideas. And then perhaps the most complicated one, how do we make sure that we have informed leaders that they listen to independent decision making? So if you have some ideas there, very much needed. And then finally, this idea of having a whole of society approach, whole of government approach. I'm aware, I think I've only got 3-4 more minutes. So I'm just going to go quickly now to our work with APO also on public health measures more specifically. So Nima had asked us to look at the public health in a few countries, but also we are now going to produce a series of, I think it's going to be between 5 to 8 papers for the BMJ that they're going to come out at the end of November. And one of our papers is also on public health measures. What have we learned? So we've come up with a framework that you can see here. And it's this idea of, we're saying public health measures, let's go back to basics. That's a bit the title of the paper. It's like, I think for public health, in terms of the pandemic, we just had to do what we already knew. But most countries were not doing the typical public health measures, and we need to understand why. For some, there was no funding. For some, there was not the relevant staff. And for some, it was not coordinated with the health system. And what we were saying is that we need to have surveillance, appropriate surveillance, appropriate testing, contact tracing, quarantine and isolation within a human rights approach. And then, of course, these need to be localized, they need to be integrated, responsive, and equitable. So we need to have, and as I've already highlighted, this idea of having social and financial supports is key. So I'm going to try to go through a lot of content. I hope I'm not overwhelming you. I'm repeating the messages as I go through. So there's not so many new messages. So, but I really wanted to highlight this and then finalize with the work that we are doing, because we're talking about public health measures. I think we all agree, and it will, I think history, I think we need a bit of time still, but I think history will prove that the strategies that were implemented in Asia the first year, they were the most successful before having the vaccine. But we still need a bit of time to see the economic impacts, because of course everybody's talking about this. On the one hand, we've seen less mortality in Asian countries, but now we need to see how these strategies impacted on the economy. But I think we all agree that it will prove that those strategies work better. But now what happens in the second year? So we produced also with Nima, we wanted to start the debate and looking at those countries that had introduced elimination, how they transition into the second year, and particularly considering the vaccination rate. So I think this, in some of the countries that we looked at, it has been a bit of a failure in terms of New Zealand, Australia, and they could have done better with vaccinating. But this creates a new horizon. First of all, what do we mean by endemicity? We're all talking about it. We still don't know what it is. I'm hearing, and I heard already in Berlin, some people saying, don't speak too fast, because we're not sure if this is going to move already into an endemic situation. They're very worried in Germany and in the UK with the rise of cases and with the Delta Plus. But overall, we wanted to highlight this idea that countries now moving into the next stage, they need to have flexible public health measures that they can adapt. And that's why you need a very strong public health system that it can be risen when the numbers increase and they can be implemented immediately. We need to make sure that we have maximum vaccination coverage, always taking into account equity principles. And also we need to think of these economic measures and also protect the vulnerable groups. So we already know that. And in the next stage, it's going to be even more crucial to involve the community and create this idea of community social responsibility, because some of the new tools that we have, they can be implemented and they can be used by the community, but they need to be taught, they need to be shown how to use it, and they need to be involved in the whole process. And then, of course, we need to strengthen health systems, reduce inequalities that we've seen it has been challenging in some countries, and we definitely need to reinforce pandemic preparedness. And my final slide, Dima, if I can have an extra minute. So we've been asked by APO to do this work looking at public health measures in Indonesia, Singapore, South Korea, Thailand, and Vietnam. And we've been doing this work. It's been challenging in the sense that we had a draft paper and then it's moving to endemicity, so we collected more data. And here I just wanted to show you a bit the areas that we are looking at. And this is a work that has been conducted by Shwanda and Monica Berna from my team. They've been leading on this work, and they produced this very beautiful graph in terms of some of the public health measures that we need to take into account and some of the areas that we're looking at. And you can see here that the support packages is key, surgeon health infrastructure, surgeon human resources, personal equipment, transmission of monitoring. It's key that we've already highlighted that. We're going to discuss the issue of border controls and physical distancing. So the idea is to do a comparative paper looking at the first year, the second year, and we have our collaborators that have already provided us with the text, and we're hoping to produce a paper on that as soon as possible. So on that note, I'm going to hand over to Dima. So I think I've covered the public health measures worldwide, some of the experiences in Asia, and then highlighting on where we're moving into the future and some of the considerations. Also wanted to provide you the global perspective a bit on what are the high-level discussions in these issues. I'm not super optimistic, I have to share with you on my final note, but we're still not giving up on the fact that the recommendations will be implemented. So I think it's our task now to make sure that this is the last time that that reports are being ignored, and that finally we kind of develop a global system that can help at the national and the local level. And on that note, I hand over to Dima.
Thank you, Helena, for that. I was going to say fast gallop through everything regarding pandemic. I was waiting for you to talk about the moon and the galactic response at some point. I want to bring in, if that's okay, views from Kathy and also from Tramai to begin with. And then again, please, if people have any questions, feel free to put them in the Q&As. We've also opened the chats. If people want to talk about issues, please bring that in as well. Kathy, you've been involved with the previous project, with this one. Putting aside the issues about the global thing, and let's focus on the, if you like, on the Philippines public health response. What are your views? Let me give it with a very open question.
All right, so thank you, Helena. No, I enjoyed actually listening to like how ideas connect, you know, from the global stage up to the national level, and we see really how, you know, all of these events, even if some governments will ignore it, no, we're connected. So decisions from other parts of the world is also affecting us, and definitely in the Philippines we felt that heavily. So I would actually start from where we left off in governance earlier. And I think that the tricky part for the Philippines in terms of the public health measures is that the pandemic actually is going at different stages, you know. So we have this early event around early 2020, and then suddenly, you know, it goes, you know, all over the country. So definitely that has impact in terms of how the fiscal space of the country. So before the pandemic, we were talking about universal healthcare, we were talking about reorganization. So we have like a mindset of where the resources will go in, which capacity we are building. And now you have this, you know, crisis that came in, and we need to like think fast of how to respond to this properly. And of course, the governance structure became what was crucial, for us to like make a coherent public health response, and also looking at how resilient can we be, especially during the first part of the pandemic. So so definitely during the first part of the pandemic, if we look at it from Helena's very nice figure from her team, and I think all of our contribution will fit into that figure nicely, with of course some variation across country. During the first part of the pandemic, we were focused on deploying activities that we can deploy given the resources that we had. So for example, we can implement the physical distancing, suppression strategy. So those were the main focus at the start. And then it became, and of course, also we have had issues around border control. So there were some discussions around it as well. I would reflect what Helena said. No? So there were some perspective around acting quickly. So initially it was around the travel border, then issues around the variants. Do we, and leveling that off with sensitivity around relationships here in this region, which is very important, maintaining the geopolitical stability. So that it factored into the decision. It was actually, I think, a complex environment for the government to decide in. So later on, it became very clear that whatever we do, if we don't have the vaccines, it's going to become more difficult, because our fiscal space is getting even more challenged, because any suppression or mitigation strategy has to be, as Helena pointed out, has to be equally supported with economic support. And to help ease that, we need vaccines. We need to be able to have more armamentarium in our response. And as we have seen, the global situation really affected us. And that delay, of course, also, went together with the variation, the variants, and also people getting tired of all the strategy to do physical distancing, stay at home. And, it becomes even more difficult for government to actually implement everything together, because you already have all of these tensions that, as Helena mentioned, you cannot actually capture this in your indicators, right? So for the Philippines, we do have those indicators. It's very clear, it's published, but, all of these like soft indicators, you don't see this. And these are like tensions that has to be negotiated within community, the government. And that definitely reflected on the decisions that would come out in terms of how the focus of the public health measures evolved along time. The determinants now of tightening or loosening the public health measure has always been very clear. Actually, the government is very transparent about it. Although it has evolved from the start of the pandemic up to now, I think around 3 or 4 times, if I'm not mistaken. So the measures have evolved, but it has been communicated to the public, the basis of certain, the risk-based rules on which public health measures will be implemented in certain areas of the country. But of course, enforcement is another thing. We are an archipelago, and our borders can become very porous, and that is actually a huge challenge for the government to do. So where do we move now? And as I think, as just like any country, especially around our neighbors, we are really moving towards living with the virus. But of course, we still need to understand what exactly would that mean, and how exactly do we do that without unnecessarily costing or causing more deaths that because of strategies that we could not implement properly. So basically, right now, what we would, I think, focus in terms of public health measure is basically for people to understand what the next steps will mean in terms of the risk and how they should behave around it, because there is no choice now. The economy has to open. I mean, we have to open. We cannot remain, you know, as close as before. So people definitely have to understand what would that mean, and this will also require better surveillance, better appreciation of what is happening in our transmission, so that we can also guide our people in specific areas of the country on how to behave in relation to how the virus is moving, and how all of these variants are also affecting the capacity of the health system to keep its population healthy. And definitely, of course, aside from, you know, ramping up our capacity and ability to vaccinate our target population, we really have to go back to paying attention to our trajectory before the pandemic, which is ensuring universal health coverage, primary health care, strengthening that, the organization at the local health system, retracing the difficulty that we have had in our essential services, because some of these really suffered because of the pandemic, and also ensuring that, you know, in the government, the economic recovery has to follow through very, very quickly, because, you know, as the people are struggling with jobs, it's also very difficult for the health system, which also relies on like premium payments, people being able to like co-pay some of the services. We have to like do all of these things simultaneously. And I think we are right now, we are moving much better than we thought in a way, because there were some really pessimistic projections in the past month. So I think we are able to counter some of that, but definitely there's still a lot of challenges in terms of ensuring that we reach the situation where we want the country to be, particularly in, you know, vaccination and restoring the economic the state of where we are in terms of our economic situation in the country.
Thank you, Kathy. Dr. On, I want to ask you to come in, and I also want to talk about what the situation is in Vietnam, and also tell us a little bit more, if possible, with regards to the thinking in the Vietnam's government when it comes to opening up, accepting COVID as part of everyday life, or going towards, for want of a better word, the Hong Kong approach of total elimination still. How do you see that Vietnam going to evolve on that?
Okay, so thank you, Dr. Nima. Firstly, I would like to thank Helena for the presentations. I think it is very informative presentations, and it provides me the way how we should look at on the healthcare system response. I like the way that you you look at on the response of the healthcare system from different perspectives. So it can help us to look at on the system specifically, so that it can help us to know which area should be improved. So thank you so much for the presentation, including the recommendation and the key message I will mention later on. So because from the presentation, I see clearly that we are aware of the issue of health system resilience. It is very important, the resilience to ensure the effective prevention and control of the COVID-19 pandemic. It refers to the ability of the health system to prevent and mitigate and overcome from the shock after the pandemic. So look at from the case of Vietnam, the government of Vietnam has implemented different strategies to prevent COVID-19 at the early stage with the decision actions. And you can see that in the last year, in 2020, Vietnam is like a success country, if we can see that, with the fields, not so many new cases and very low proportion of the death rate due to the COVID-19. But in this year, the situation a bit changed. So why we suffer from such kind of the situation? And from the experience during the four waves of COVID-19, because now we are in the fourth wave of COVID-19, we draw some lessons from that, and we see that the governance and leadership plays very important role in preventing and controlling the COVID. So in Vietnam, we have very high commitment and determinations of the country leaders, and we have a good strategy in engaging the entire political system and multi-stakeholders involving in preventing and control the COVID. Especially, we are aware that the role of community is very important, so that the community are mobilized and empowered, and they engage proactively in implementing the public health measures. So we see that when we encourage them, engage them into the implementing public health measures, it is like the way to improve trust of a population to the government and lead to their compliance in implementations. So from the fourth wave of preventing and controlling the COVID pandemic, we see that the capacity of the healthcare system is very important. It is not only the capacity to respond when the pandemic occurs. This capacity need to be prepared, well prepared, before the pandemic occur. And we see that even in Vietnam, we learned that the healthcare system needs to be well prepared. It needs to be more strengthened and need to be well prepared. So in recently, Vietnam, how can I say? We have the strategy like revised, not revised, but our strategy a little bit changed in terms of preventing and controlling COVID in the new situation. Where Dr. Nima mentioned that so far we expect that zero COVID in the society, but now we identify that we should be able and should prepare to live with COVID-19. So our preventing COVID-19 strategy a little bit changed where we see that vaccination is very important tool to dealing with the COVID, plus with the public health measures. Because we think that public health measures being very important, that make the people to comply with the different measures to reduce transmission of the COVID-19. And also, we have strategy to ensure the good capacity of the health service delivery system. So we understand that it is not only in terms of infrastructure, but also very important in strengthening the capacity of human resources and focusing on the grassroots healthcare system. At the moment, so far in the treatment, all our COVID cases are treated in the hospital. And after the fourth wave of COVID, we realized that the role of primary healthcare and healthcare grassroots level should be strengthened, and they should be responsible for treatment of the COVID-19 in the communities, which it accounts for 80% of the infected cases. So recently, we recognize more on the important roles of primary healthcare and healthcare at the grassroots level, and the government put more investment and pay more attention at this level of care. So in conclusion, But I would like to point out a few points from presentation of Helena, and I think it is very important for Vietnam. The key message. I pay attention to the key message that she draw from her presentation, and I see that the public health functions is very important in preventing and controlling COVID, including the surveillance, testing, and contact tracing and quarantine. So the government, the system, need to be well prepared to perform well the public health functions. It is very important. And the second message, it is also important, and we learn from that. It is the ecosystem. Ecosystem is very important in dealing with the COVID-19. The ecosystem of the public health response to the pandemic. It should be pupil-centered, and it should be flexible and make it appropriate with the local context. It is very important because, like so far in Vietnam, we applied like a uniform strategy for the whole countries, and even with the social distancing. From the beginnings, it is for the nationwide, but after that, we are aware that the public health measures and the strategy need to be implemented. How can I say? It should be flexible, and it should be according to the local context, so that it can empower the local people to identify appropriate strategy to prevent and control the COVID in their own setting. So I see that it is very important point that Vietnam can learn from documentations, and we should look at all the lessons learned we have, and then considering what you recommend from the international experience, so that we can improve our strategy to prevent and control the pandemic of the COVID. So thank you very much.
Thank you, Dr. On. I've noticed that we are getting close. I haven't any questions coming up, but we still have a few minutes. And let me ask this question. You mentioned about building back better. In effect, a strategy where we are looking at what happens after. How can we use this as a means to move forward the UHC issues? And it fits into what you were saying, Helena, when it comes to the iceberg issue and things below for the future, as opposed to response issues. So let me put this to you guys like this. You know, in Southeast Asia, there is a determination to move on primary healthcare and use primary healthcare, strengthening that as a means of making the system more resilient, and also as a means of achieving UHC, so achieving two different goals at the same time. How is your experience? And let me start with Kathy, and then Tramai, and then Helena for the last few words on that. From the, if that's okay. And then with that, we can close the conversation. So Kathy, feel free.
All right, so definitely this is a strategy that is recognized by the Philippines, and in fact being advocated by most of the sectors who really care about building back better. I think the main challenge is doing it really closely with the communities. We have challenges in ensuring that you design really good policies, but ensuring that that policy is well understood and well accepted by community is another thing, and that relies a lot on, for instance, the nature of engagement, the capacity of local health systems to also like contextualize or customize the national strategy. And at the moment, from what I know, that is where the focus is, building their capacity of local health system to translate plans at the national level so that they're able to do it in a more inclusive way and in a way that works for their system. And also partners who are supporting at the local health systems are also focusing on this, building their capacity to do just that. That it's not just a lip service, not something that we just want to say, but it actually happens because you engage the community, you are able to make the strategy fit for them. So a lot of it really revolves around education, making the community participate and being able to give feedback whether the strategy works for them or not as well. And lastly, I think the one important thing in this, again, would be information, the data, and being able to understand which of the strategies are working well in which context. Because even within the Philippines, the situation is very varied. So once one building approach in one area may not work in another area. So in the UH one of the sections there really is about research. I think that is an important key here, that when we build back better, we need to get information. We need to learn as we are doing it so that we are able to correct if there would be mistakes, and if there are wins, we can quickly build on this moving forward.
Thank you. So monitoring and making sure that it's contextualized to the location and including the people-centered. Dr. Owen, any comments with regards to building back better? We mentioned it already, and then quickly, Helen.
Okay, thank you for the issue that you just raised with the determination to move on primary healthcare to make health system more resilient. I think it is a very important point, and even like in the country like Vietnam, we are aware clearly on the role of primary healthcare and healthcare at the grassroots level, but we still have to face with many challenges in terms of this issue. Firstly, is that like a similarity to like the Philippines, the capacity of the grassroots level. The capacity here, we would like to point out that in terms of the human resources capacity, it is not only on the quantity, lack of the quantity, but on also the shortage of the quality as well. When we lack of the human resources at the grassroots level, and from the COVID, the prevention and control, recently in the fourth wave, after we we applied the model of treatment for the COVID-19 cases at the community level, where the community health stations are responsible for treatment of the COVID-19 patients. We see that the human health workforce, the lack of knowledge and skill in preventing the pandemic. Even there is a concrete guideline for them how to do it, but in reality, there's still lack of knowledge and skill in doing that. So when our country implement treatment for COVID-19 at the community, I think it is a right strategy, but we need to be well prepared for that in terms of providing training to improve the capacity for this health workforce, so that they are, in order to help them to be able for the treatment and monitor and management of the COVID cases in the community. Because when we accept that we should live with the COVID, it means that we need to understand about it and need to know how to prevent it and proactively. So we need to improve their capacity in order to help them to be able to manage the COVID-19 management, because so far we are talking about the management of NCD, for example, but in the future, in the coming times, we also need to strengthen the capacity of the primary healthcare, so that they are able to manage COVID-19, like the COVID-19 management at the community. It is the first challenges we see. The second thing is that even we change the strategy in preventing COVID-19, where we see that the vaccination is very important. The problem is that how to ensure adequately vaccine for the population. It is another issue because, like in Vietnam now, there are 70% of people from 18 years old and above having the vaccination for the first dose, and so for the fully vaccination with the 2 doses, it just accounts only for 29%. In order to dealing with the COVID-19 prevention, vaccination is important issue. The last issue that I would like to raise here is that the healthcare system needs to be well prepared before the pandemic occurs. So it means that the healthcare system at the local level, they need to develop the plan, the comprehensive plan, to prepare for that, so that they can have the with different scenario. I mean, the plan here should be developed with the different scenario of the COVID pandemic situation, so that they know what are the gaps, so they know how to improve their own healthcare system. So it's just some of the some challenges that I would like to point out from the case of Vietnam. So thank you.
Thank you. So basically what I'm hearing is the importance of integrating the primary healthcare to the higher echelons so that they can function better, and B, the big challenge has always been, if you want to make the system resilient, you have to train the people so that they understand what they are doing. And this is particularly the case in the primary healthcare. Helena, last few words. We are running over time, and I can see the next panel is waiting very patiently. So I'll give you the concluding couple of words, and then we can move to the next session. Thank you.
In 30 seconds. So I agree with Dr. On and Dr. Reyes in their comments. I think for us now moving forward, I think we all completely agree that primary healthcare is crucial. And that also universal health coverage, I think we are all in agreement that it's also crucial. But now we're going to be contested with a few issues that we need to reconsider. And it is the fact that, unfortunately, it was not very evident that those countries that had universal health coverage did better in combating COVID-19. So that's going to be a challenge for all of us in health systems. It's like, how do we convince policymakers that UHC and primary healthcare is the way to go forward when it has not been proven in reality? So I think for us, it's going to be thinking a bit about it, trying to find the connections, because we did the analysis, and definitely we look at the UHC index and we looked at how countries performed, and there's no correlation with UHC, unfortunately. The positive side, and I think this is what we can work towards, is that it has been shown quite clearly that vaccination in those countries that have universal health coverage and also that have a strong primary healthcare system, particularly in Europe, they've done much better. Public primary healthcare has been proven to be key. Those countries that have private primary healthcare, they've struggled much more with the vaccine. So basically, I think we all agree on what are the solutions, but we're going to have to find creative ways to convince our policymakers of what are the key aspects. But I'm sure between all of us, we can come up with our research and our collaborations, we can come up with convincing arguments. But that's going to be, I think, for us, the challenge ahead. But I'm looking at it from an optimistic point of view. Over to you, Nima.
Thank you. And I would argue that UHC systems were never designed to deal with outbreaks of this measurement. So of course they didn't particularly show anything with regards to response, especially the public health measures response. Anyway, that's my 2 cents worth. Thank you very much to all of you. It's been a fascinating talk, another fascinating talk for the 3rd session, and thank you to all of our panelists.